Yes. All right. So I am here with Connor Petty, DPN, DNP, APRN, CMP. All right, man. I'm happy to have you here
Yeah,
today,
thanks
man.
for having me, Darnell.
Yeah,
Sure.
man. I'm pretty excited about this.
Yeah.
We Just a little background. I worked with Connor at the Veterans Center, that's where we first
Yep.
met.
Yep.
And at the time, he was a registered nurse, and he was a
Yep.
nurse practitioner school. He was also the manager for 311 ship at the Veterans Center.
Mhm.
He was Superman, in my opinion, because he has a full time family and kids and animals, and I mean, just amazing, man. So
I don't know. I had some kryptonite in there. I don't know if it's Superman, but
I don't know, man. I mean, it
I
was
tried. I
pretty
tried.
admirable what you were doing, man. I got to
Thanks.
go ahead and give you props for that, man. So
Yeah.
tell us a little bit about yourself, man.
Yeah. So started in nursing. Really, my exposure to kids with autism and Down
Okay,
syndrome was kind of first.
nice.
At first, I wanted to be a herpetologist and study reptiles and be Steve Irwin, and
Okay, okay,
my it was to the vein of my parents that I kept a lot of reptiles at home. But
okay, okay.
anyway, yeah, in high school, I went to a camp called Camp Barnabas. It
Nice,
really changed my life. Got to see where I could be a nurse and help not only patients but friends that
nice.
were on the spectrum, and that really got me interested in neurology
Okay,
to start out. And then as I started my journey, I realized I wanted to go back to school and become a nurse practitioner,
nice.
and then pursued my doctorate in that, and then found myself working in neurology. So that's kind of a full package
Okay,
dream
yeah.
that took a span of almost 15 years total, but I was a nurse for 8.5 years almost, throughout that time, and doing
Great.
graduate work and working and family, things like that. So that's kind of the long and short of it.
Okay. Okay.
Yeah.
I mean, that riptology dream, that would have been something, man.
Yeah, yeah. I figured out pretty early on that I enjoyed the human connection more, and figuring out where I could play a part in somebody teaching me about
Okay.
more of the human experience. And so I still have that nerdy side, and I'm seeing more of that in my two daughters as well, as they catch animals and bring them inside, and we're constantly finding bugs or whatever it
Okay.
is now, and my daughter wanting to go on snake hunts and things
Nice.
like that. So it's
Nice.
still there, but
Okay.
definitely not as a workplace thing.
Okay. Okay, man.
Yeah.
That is awesome.
Hmm.
All right, man. So tell us a little bit about like where you currently work, what you
Hmm.
typically do, and your role in that.
Yeah, so I work at private practice neurology care here in Ardmore, Oklahoma, with Dr. Abouje, and um, we see headaches, migraines, sleep
Okay.
disorders, so obstructive sleep apnea. But we're really more of a general neurology practice because we're in a more rural area, so there's not a lot of access to neurologists, and
Yes.
so
Yeah.
we treat epilepsy, memory disorders, dementia, Alzheimer's, Parkinson's. We do nerve conduction studies, looking for neuropathy, polyneuropathy, and radiculopathy. We also look at tremors,
Okay.
kind of a broad spectrum of
Awesome.
neurological disorders, post stroke, things of that nature, where we're dealing more with the brain and nervous system, all in all, at that practice.
Okay.
Mhm.
So we'll start something small. So like headaches,
Yes.
right? So
Yes,
you guys deal with headaches quite a bit.
we do. Yeah,
Okay.
yeah.
Okay. Do you feel
Mhm.
like that's like something that's on the rise, or you feel like that's something that's just,
Mm.
kind of there? Like how do you feel about, headaches right now?
That's a good question. So the presentation of headaches hasn't really changed. I mean, the
Okay.
diagnostic criterias are pretty similar throughout the years. Um, we do see a fair amount of trying to identify triggers in younger patients. We primarily see adults, but
Okay.
just because of access, we do see some children or pediatrics, and trying to figure out if it's an exposure to blue light or sleep, diet. I mean, there's a lot of contributing factors that can play a part. And then sometimes organically and familially, migraines that we can see passed down. And those are more where we have to have medical intervention as far as medications. Thankfully, there's a lot of options and different management. It's not really cut and dry as far as what medications work for certain patients and which ones don't.
Okay.
It really is. It's exciting because it's also an art as far as figuring out with patients and identifying with them where we can best manage
Hmm.
their symptoms. And really, the biggest thing is prevention and then abortive therapy. So, something that they can take as needed. In Oklahoma, we see a lot of weather changes.
Oh
And so,
yes. Oh yes.
a lot of patients have that as atmospheric pressure changes, allergies, sinus infections. So, it is really kind of a tip of the iceberg
Okay.
of trying to form a relationship with our patients to identify, are there ways we can dial down the intensities of
Hmm.
their migraines and prevent them ideally, and then different criterias as far as if Botox injections or we do nerve block and trigger point injections. So if those are another adjunctive therapy
Right.
or primary therapy based on their frequency and intensity and longevity of their headaches and migraines. Um,
Not to cut you
uh,
off. I mean, there's
yeah.
some people who they hear the word headache and they think like migraine is synonymous. Some people think like
Mm,
they're the
yeah,
same.
yeah, yeah.
Can you tell us the
Good.
difference between what somebody calls a headache versus a migraine?
Right, right. That is a good distinction. So a lot of times, how I differentiate headaches will sometimes build into migraines. So migraines are more of a long duration,
Okay.
so greater than 4 hours. Most patients have phonophobia, so sensitivity to light, sound, sometimes nausea. And the biggest thing is identifying when a patient has a headache
Right.
or a migraine, what do they do besides medication to make it
Hmm.
better? So a lot of times with migraines, you'll hear patients say, "I want to go to a cool, dark room
Hmm.
and sleep for a while." Where a headache it can be very sudden and very intense, but doesn't last greater than 4 hours. That's kind of the real big distinctions.
Right.
Each person presents a little bit differently, and
Okay.
with migraines, we can see over time people's pain tolerance gets pretty high,
Okay.
and so as we start to treat, they start to realize where they were having more migraines than they thought. Or that they had migraines building on top of each other. So we do
Mm.
that's where the nerve block injections, trigger point injections are really nice, and cocktail injections for that matter, are helpful in breaking through those like 3 4 day migraines that patients deal with. And the biggest thing is identification early
Okay.
on. People in a primary care setting may not notice that that's causing a lot of their other symptoms
Mm. Okay.
of memory or focus or just overall pain. And
Interesting.
so by treating that and dialing those intensities down, they're able
Hmm.
to focus more, function within social environments because too. We have a lot of people under ambient light, and
Right.
exposure to computers is a big thing that we're noticing. I don't know if I'm fairly new to the practice, so
Okay.
I can't say that we're having an influx in that
Right.
based on computer exposure, but it seems that there can be a trend there as far as the necessity of using a computer more. So we use a lot of, or suggest a lot of like blue light canceling glasses or screen protectors. Um, Again, it's not going to fully take those away, but
Right.
dialing down the intensity and triggers.
Interesting.
Mhm.
So you say increased screen time. Is this
Mhm.
we're talking about kids, we're talking about adults, a combination of both, or what are we seeing here?
Really across the board.
Okay.
In cell phone use too. We now
Oh, of
can't leave
course,
the
of
home
course,
without
of
that,
course,
or
of course.
it's like attached to our hand, and
Okay.
so um, that's really across all ages.
Interesting.
Again, it's not one of those things that's where the migraine comes from,
Hmm.
because you can have it organically, but it is a contributing factor, and we can't really get away from it right
Okay.
now, at least how society operates with those. So,
Interesting.
trying to mitigate the risks and treat the symptoms at that point.
Interesting.
Mhm.
So, at what point should a person seek medical attention? Like, if they are having a headache, let's say they're having a headache for 3 or 4 days, it's throbbing, it's sharp.
Mm.
At what point should a person, like a regular person who doesn't see like their primary care doctor as they should, or they don't see a
Right.
neurologist, they're experiencing headaches. At what point should they seek medical attention?
Right. So, from a nursing and medical background, headaches are a symptom of some pretty things you don't want to miss.
Yeah.
So, whenever you start to have a headache that's debilitating, or you're not
Hmm.
able to function daily, or it's changing in characteristics,
Okay.
sometimes we'll even have patients that have difficulty with balance or
Right.
difficulty with speech, and those are kind of the tip of the iceberg. So, really need to look at imaging, making sure there's no physiological response to the headache. So,
Okay.
tumors, strokes, things of
Mm.
that nature. So, it's a good question.
Yeah, for
My
sure.
default in primary practice or clinical practice is go to the ER.
Oh, yeah,
make sure,
yeah.
make
I,
sure at that point we're not dealing with something that's more acute.
yeah.
If it is more of a subtle onset and symptoms, bringing it to your primary care,
Mm.
that can then evaluate, do I feel comfortable treating this, or do we need neurological evaluation for a more complex or atypical presentation?
Interesting.
Mhm.
Okay, so how often do you guys, maybe yourself, deal
Mhm.
with epilepsy?
Um, it's a pretty large portion of our practice and Dr. Abuja's practice. We do EEGs, which are brainwave studies, and then ambulatory VEEGs. So those are 72-hour
Okay.
to hopefully catch those. Percentage basis, I would be hard to say a strict number,
Okay.
but it's a pretty large majority. The the true epilepsy, not so much,
Gotcha.
because a lot of things present as seizure-like activity that are not epilepsy. And so that is probably the biggest thing we have to, one, educate,
For sure.
and then two, differentiate within diagnosis. That's why the EEGs and ambulatories are very, very beneficial,
Okay.
because of not only do we want to give the patient the right treatment, but we also want to reduce medical expense, because seizures are scary. You
For
lose
sure.
consciousness, you can have injuries, but there's a lot of other things that can manifest that way: cardiac changes, blood pressure
Hmm.
changes, blood sugar changes, and so a lot of them aren't. Or the etiology isn't
Yeah.
epilepsy,
Yeah, for sure.
but working it up and making sure that if a patient is having epilepsy, that we're treating it appropriately,
Interesting.
and helping them get the most relief of their seizure activity.
So if somebody is actively having a seizure, let's say
Mm-hmm.
somebody doesn't have a medical background, what
Mm.
advice would you give to those who maybe
Mm-hmm.
witness a seizure, or what
Yep.
should they do if they witness one?
Good question. So the biggest thing is keeping the person safe. Uh, Getting them on their side, getting them to the floor safely, make sure they don't hit their head.
Right.
Um, Seizures are very prompt and typically do not last very long. True seizures,
Okay.
and so um, you're not going to physically stop a seizure. I like to explain to patients that it's similar to the electricity in your house, and so you have all the lights on, then you plug in the curling iron, the power goes out. That's similar to how your brain is working at that point. It's doing a reboot, and
Right.
it's kicking back on the system. You got to flip the breaker, and so allowing them to have the seizure, but keeping them where they're not going to aspirate or vomit. So keeping them on their side, so they're not choking or inhaling that getting into their lungs.
Yes.
And then the biggest thing too is a safe environment. So getting them to the floor, cushioning their head. And when I say cushioning, there is a caveat there, making sure that they're not on a pillow or something that could block their airway. But it will resolve. Some do not. In those cases, EMS or making sure if this is a new presentation, getting emergency care personnel involved as soon as possible. But knowing that if you're keeping the patient safe and you're with them so that they do not injure themselves, it will subside. It will resolve. And so not trying to stop it or not putting anything in their mouth. I think that's a misconception that they'll swallow their tongue or anything like that. We do have a lot of those questions as far as it is. So
for sure,
get them in a safe position on the ground and on their side.
Yeah, because I know that for some people it can be a pretty scary experience if they see it for the first time, especially if they don't have like any medical training or anything like that. So that is pretty good advice. So how often do you guys deal with like Parkinson's disease?
We have a fair amount of patients with Parkinson's, and a lot of times it is differentiating to as far as is this an action tremor or is this a resting tremor? Yes, and Parkinson's really don't have a diagnostic test that truly rules that out. So we are, besides an autopsy, which we don't prefer to do,
especially not alive.
No. So a lot of that is identifying characteristics. There are DAT scans that can help with understanding dopamine levels within the ratio of the population. It's not as specific, but it is a good clinical tool to say this is most likely where we're going as far as Parkinsonism, so characteristics of Parkinson's, and early intervention. So a lot of times being able to intervene earlier with the braided kinesia, so the stiffness of movement, and keeping with safety of falls, definitely helps long term. Because once we have an injury with Parkinson's, it is greatly hindered on our healing, and mortality at that point. So we see a great deal of it. Again, I'm remiss I can't say
you're good.
Percentage.
You're good.
But
you're good.
It is a large majority of what we can see.
You're good. So we're going to shift gears just for a little bit. Let's talk about a subject that I feel like I'm pretty passionate about. Let's talk about men's mental health. Let's talk about it. I was watching a podcast recently. I think it was the Huberman Lab. And he recently had on a guest that was in the military that talked about, like, I think he said like 77% of men right now don't even qualify for the military because of either obesity or mental health or some type of drug abuse. Like that represents a large percentage, and really,
I haven't heard that statistic.
And I know that I'm throwing that at you there, but it makes me think about a much broader subject, and maybe think about the mental state of a man. It makes me really think of that. First off, I think that there's a stigma with men and mental health. I know there's been an increase in awareness of programs and things of that nature. But why do you think that we as a society, here in America especially, that, and once again, I know that statistic and I'm just throwing that at you, but why do you think like there's an increase in like drug abuse within men, obesity within men, decline in mental health? Like, and I know this is probably a broad subject, but just kind of give me your thoughts on that.
Yeah.
What do you think about that?
Well, I think the statistic is shocking, but not surprising.
Yeah.
Unfortunately.
Yeah.
So as far as men's health and mental health, looking at the different variables within
Yeah.
that, I think trying to synthesize that into an organized fashion, I really look at uh, faith, family, and fun. I think are like three
Okay.
pillars that I see as being change agents
Mm-hmm.
within recent changes in health. So, kind of identifying that more so faith. So, a basis of spiritual life,
Yes.
but also it goes to a broader spectrum of socialization, where men historically do not hang out together very often,
Okay.
or our interactions are different. So
Yeah.
it has to be
Yeah.
around a project or something that we're
Of
doing.
course. Of
Yeah,
course.
and getting something done and things like that. But
Right.
um, that is on the decline in both sexes, male and female,
Right.
as far as interactions in communication. And I think within that, as far as both of us have worked at the Veterans Center, seeing
For
that
sure.
World War II Korean veterans and Vietnam veterans, and like seeing those generations of where at ages 12, 13, 14, and 15, there were men interactions where the child was seeing an adult male and saw not saw some fear, but
Yeah.
also saw some characteristics and emulation
Right.
that was, hey, tuck your shirt in, like get to work and do. These are the things of a habit,
Yeah.
and I don't. I don't see that interaction as often, and I
Mm-hmm.
think those are really formidable. I had the blessing of both my grandfathers were veterans, and the one that my father's father was a World War II veteran. He was a medic, but instilled in me at really the age of 13, but I really understood what he was doing at 15 when he started writing me letters that said Master Connor Petty. And it was like, hey, this is a
Okay.
title now. You have
Right.
a responsibility. You need to have some way of being valuable.
Yes.
And that could be making fries. It could be stacking
Anything.
bricks.
Anything.
Whatever it
Yeah.
is, you're contributing to society. So I say that in faith, that you have a vision, that I have value, intrinsic value. If that's bringing, if physically I can't do something, I'm bringing something intellectually
Yes.
to the table,
Right.
and I'm interacting with other adults, and understanding that there are stressors in life that I can overcome.
Right.
And so I see that missing. The other is family. So it kind of comes back to that socialization and core value.
Before you hop on the family subject, I
Go
just want to
ahead.
kind of piggyback on what you said. You come from a military background, and it's interesting. I have military.
I haven't served. I'm sorry.
Okay, well, I'm just thinking about just the family aspect.
Yes,
like you have people that have served, and I have as well. I have a brother that's currently serving in the Air Force. I have a uncle that used to serve in the Army. I have a grandfather that served 20 plus years in the military, and he was a sergeant major. And it's kind of interesting. Those guys that I'm mentioning have what's called a sense of duty. And I think that's missing in a lot of males today. They don't have a sense of purpose or a sense of duty to want to protect somebody else. And just taking care of veterans before, well, that's one of the things they were honored to do. They love serving their country, but they love serving their fellow brother in arms as well. And so just to kind of piggyback on what you were saying, you talk about the faith aspect, and I wholeheartedly agree. Men have to get together with other men. We're not in this journey alone.
Yeah.
So we're not in this alone. We're not in this alone. Okay. I want you guys to know we're not alone. Okay. And we're better together than we are apart. And some of you may be missing a sense of duty. So I'm gonna go ahead and throw at least this recommendation out there before we hop on the family aspect. Get you a men's group. Find your local church or you find your local men's group, join them. Okay. That can help increase your mental health, keep accountability of one another, keep up with one another, and that can also improve your mental health. You're not alone. Okay. There's so many groups out there that are willing to help you, and you do not have to do this alone. You can help find that sense of duty. So, sorry.
Well, and I think that's great too, as far as understanding you're connected to others. But you're also connected to a mechanism and a thing that's going to keep going. So the world's going to keep spinning for the most part that we know of. But having that faith that, hey, this may be overwhelming right now, but pick a task. Make your bed. And I'm not the only one that said this, and this isn't new knowledge, but I think we too easily forget that we want to do everything at once and be this world changer. But it really starts with doing one push-up a day. Like really the small tasks, how you do the dishes matters. And how you just interact with other people, the small things. No one has to be looking at you. You don't have to Instagram that stuff. Sorry, I caught myself.
Oh no, you're good. But you're right. You're right though. You don't have to do that.
It's just like do it because it's you.
Yes.
You take pride in you are you, and you have something to value. And you might be behind on your bills, but there's going to be another day, and you've made it through all these other adversities in your life. So you're going to keep going over those. And so, it hasn't defeated you yet. And I think there's this defeatism in the loss of faith that I can make a difference in my life, and I can, because there are external factors that we can't control.
Of course,
you can control what you put in your body, and when you wake up, and how you brush your teeth.
Things
like that. So pick those things and win those battles. And then life will get better. That's just as simple as it is. I don't know.
Just making those small steps, not trying to conquer the world in one day.
And you can conquer the world, but it's not this like the sky opens up and things. Usually when the sky opens up, that person's prepared for 20, 30 years. Like it's not that they just happen to be at the right place. It's that they were grinding and working their butt off to get there. And then they hit the timing right. It's not that, and you have to be prepared for the timing. I think that's where most men get defeated is, I missed an opportunity. Well, you weren't ready, so now get ready for the next one, because they're going to keep coming.
And just to kind of, I just want to talk about the family aspect too. You know, I think that in 2024, last time I saw the data, U.S. is having declining birth rates, and I think a lot of men are missing out the joy of fatherhood. Now, granted, I can understand there's other factors that go into that, which may be time for another interview to dive deep into that. But I think that, and I'd like to hear your thoughts on it, but I think if men stepped into fatherhood and embraced fatherhood, they would actually see the joys of actually raising a child, taking care of seeing that boy grow up, that girl grow up, whatever, and taking care of them instead of running away from fatherhood. I mean, I don't have the data per se right now, but of course, there's an increase in single motherhood, and of course, it takes two to tango. And a lot of these guys there's some deadbeat dads walking around, and I think that can also contribute to the lack of mental health. And I think fatherhood could boost that. What do you have to say about that?
My perspective in it is a little mixed, I guess. So the high school I went to had a daycare in the basement. So at sophomore junior in high school, I had friends that needed to drop off their kids or couldn't get their GED because they're needing to work or things like that. So pretty unique perspective as far
Yeah.
as I haven't heard many people that had that, but we did have a lot of friends in high school that ended up finishing their degree or helping get their partner to get their degree, and at least the high school degree, and,
Right.
and the potential of moving on and moving up and taking care of that child too, because there wasn't always a family support system there. The so that's kind of my context into, I don't know about early fatherhood.
Oh yeah. I know. Yes. I guess I could have prefaced that a little bit better, because it's better if it's in the right situation, for sure.
Yeah.
I could have prefaced that a little bit better, but talking about two people that are married, holy matrimony, and they are raising kids together.
Yeah,
that's the better. Put it better that way.
So yes, I think that is one of the aspects of understanding that life is only going to get more complex.
Yeah.
So responsibility to small things, as they grow, they become more fun. and I think that's kind of the third pillar I talk about. It's like discipline and doing the things you have to do the things you want to do is a good thing. Like it's not absent of that. I think too often we and don't get me wrong, I love sometimes David Goggins, what he can say as far as motivating people.
Oh man, David Goggins. Okay.
But you got to be careful with that, because I think that becomes the next extreme. It's like,
it is.
I can't do that, so I'm not a man. It's like,
I know what you're saying.
Yeah, like,
I know what you're saying.
Don't go into kidney failure, please. Like,
please, for the love of God, no, please, please.
Make a plan and execute that plan to achieve that. He has done it in his own way. I'll say that. That's He's on him.
Probably one of one, actually.
Yeah, exactly. Yeah. And to come back from some of those injuries he's had is phenomenal. And it plays a part in mindset. And I think that's important. But I think for the average person, getting to where you understand what the responsibilities are coming up is important, because the quicker you can flip on that switch that I need to get this task done, and it'll take me less time to do it if I just buckle down and do it than to worry about it. Because I think we try to multitask, and that's a myth. I mean, we just don't multitask, and neurologically we don't. We turn one task on and off. And so being a father is juggling multiple tasks, but being very, very focused on, I need to look at the budget. I'm going to get the numbers right now.
Right.
And then I'm going to go make dinner. And the time I try to stir the pot and do the numbers will take me twice as long. And so understanding where episodes of fun is and where responsibility is important. And I think having children and being a father, or having that goal in mind, helps with that. The other side of that is I think there's not so much a generational thing, because this has been ongoing, but access to immediate dopamine surges, and that pornography is one of those. And
before you dive deeper into that, I just want to let people know, he mentioned David Goggins. For those of you who don't know, because everything's viral nowadays. So if you've heard the clip, "Who's gonna carry the boats and the logs?" If you ever heard that clip, then that's David Goggins. Okay, and he's the one that says, "You don't know me, son." Like if you take the time to look up David Goggins, if you don't know, that's the guy's name is. So just wanted to clarify that. So
his book, "You Can't Hurt Me," is excellent. Caveat: it's for adult audiences. But it gives some insight into where he is now. Yeah. And so I think that is very, very helpful for people to understand how to take his message in a positive light. I guess I'll leave it at that. Just
not to the full extreme.
I should have explained.
No, you're good. Just not to the full extreme. If you know, you know.
No, the tibial fractures.
So you talked about dopamine, pornography. Like, let's talk about that for just a second.
Go ahead.
Oh no, go ahead, man. You mentioned it. I just wanted to kind of bring that back up, get us back on
Yeah.
the path there.
So that's one thing as far as family, like you talk about men being a father,
Yeah.
understanding that there are pleasures in this world, things in this world that are good for us and that we enjoy that take a long time to build and take the only time you're going to get that euphoric flow state is when you've focused and anchored down on something for a while and committed to it. Where I see that deviating, a pretty obvious example is pornography, and as far as dopamine surge and neurochemically, what's that doing to men is creating a divergence of what it takes to get pleasure. And so, what I mean by that is, in typical circumstances, men have a drive to procreate,
Yes, they do.
and that's a good thing. That's a human thing.
Yes.
So, in that, you get some good cologne, you get a nice clothes on, you ask the girl to a dance, buy her flowers, you take her to a dinner, you have a good conversation, you have to engage, you have to listen.
Right.
Then you can get the rewards from that and committing to what that is. With pornography, it's like there is no human connection, no aspect of that there is a tie to, if I want to gain something that is a natural feeling, that I've got to work my butt off and understand how I do this respectfully, how I do this kindly, and how I honor what a gift is that God gave us, and that we can interact with the opposite sex. And so that aspect of fatherhood is understanding that I love my children, but they know my wife comes first. You know, that I chose her and you are a part of this, but hey, we're here, you know, like this is us. And so understanding how that commitment is, and in fatherhood, how we cultivate our children to understand that there are no quick fixes to life. And that's a good thing. If you don't sit down and chop that wood, you don't appreciate what that wood is, like what that if you grow a garden, it tastes better, it tastes different because you know where it came from and what it is. So
I'm gonna go ahead and say it, man. You're gonna go ahead and piss some women off because you said that they're like, no, my baby comes first. So you can go ahead and you're gonna piss some people off. I can already see it. No, nobody comes before my baby. So
that is, well, and I think that is a cultural thing too, where I was deeply loved. Like as a child, I had a great upbringing. I'm super blessed. But there were instances where I knew I was to be quiet. There were some times where you need to go play downstairs, and the adults are going to talk right. And that helped me realize too, this is a priority because we're building something here. And so yes, love your kids, but understand where that sits, because and I think I'm gonna make some people mad. So
sorry, man. Sorry.
So yeah, love your kids, but I think there is a pedestal we can put children on that then they don't understand I'm not first. And when they get to that teenage years or 20s, that is a big shock to go into an employment and be like, well, I want Saturday off. No, I need you to work that day. Right. What do you mean? I asked. Yeah, you asked, but I gave you an answer. And I think there's a disconnect that, like, since I asked politely, I get it. Like, no, that's not it's not how this whole system works.
Exactly.
That is a thing, I think, as far as fatherhood and family, that understanding that the world is bigger than you, and you are to treat it with kindness and treat it with a certain level of respect. And that goes for other people too. Like you're not the only one walking on this path here.
Right. Right.
So.
Well, Connor, man, I would love to keep going, man. We are already over our time, man. They got an hour, and we're already at 10:04. But we're gonna have to do this again, man.
Yeah,
to talk about a lot of other subjects too. But
definitely.
So anyway, man, just to kind of recap. We talked a little bit about your background. What you do.
Yeah.
We talked about different neurological disorders, headaches, migraines, epilepsy, Parkinson's disease. We touched on men's mental health, which is a broad topic.
Yeah, this is one of 5 episodes or something.
Probably, man. I'm telling you, like it's a need.
Yeah.
It is definitely a need in this day and age. But anyway, man, I do appreciate this time that you've given me, man. This has been awesome. So
I'm glad to give it. So
yeah,
this has been fun.
Yeah, man. I appreciate you, Connor, and we'll look forward to doing this again, man.
Definitely.
All right. Thanks, man.
Yeah, thank you.
If you guys enjoyed the content you see so far, feel free to like, comment, subscribe. We got many more videos on the way, many more interviews on the way. So always show support. Thank you, guys. Love you.